to understand the root cause of not only the cervical cancer, the vulval cancer, vaginal cancer, head and neck cancer, and the troublesome extragenital lesions like genital wart. In this COVID situation, we are neglecting very important aspect of our routine immunization program. That is, and you know that few outbreaks of different vaccine preventable disease occurred, like measles, in the countries which are not supposed to be. In this context, we from MSD India privileged to welcome you all in this virtual seminar on scientific evidence and counseling techniques to save more lives from cervical cancer in routine clinical practice. Today we have two eminent personalities, Professor Dr. Sharda Jain and Dr. Arun Wadha with us. Today we will start our scientific session with presentation from Dr. Sharda Jain. It will be followed by Dr. Arun Wadha. And you can send the questions in between, and we will take the questions after completions of these two lectures. Now, first, I would like to talk about the first session of Dr. Sharda Jain. Dr. Sharda Jain will talk on saving lives from cervical cancer. Obstetricians and gynecologists can make a difference. And really, for an introduction, I feel that Professor Jain really does not need an introduction in the field of Indian gynae and obstetrics fraternity. And I am privileged to introduce Madam formally in this august audience. Professor Jain is an obstetrician and gynecologist with truly multifaceted personality. With her rich experience in academics over 4 decades, she is known as teacher of the teachers. In his teaching career, Dr. Jain, Sharda Jain was the faculty of one of the most prestigious institutes of India, PGI Chandigarh, as well as in Lady Harjinj Medical College. Professor Jain is a ethical committee member of Medical Council of India. Dr. Jain has a passion for women health, and it drives her to contribute to the society through multiple social welfare initiatives like National Movement for Female Feticide, Anemia Free India, Adolescent Health, Save Uterus, etc. Her tremendous contribution was recognized by Foxy with True Lifetime Achievement Award. It is our privilege to learn from Madam with an experience of more than a century of medical practice. Half a century of medical practice. Over to you, ma'am, please.
Thank you very much. I will just take a minute and share the screen. Yes. My greetings to all vital cancer prevention. I'm a teacher, and the teacher is just like a lamp. If it does not ignite others, this light will go off with her. But if this lamp ignites thousands and thousands of people, then this light will be never ending. Coming to cervical cancer prevention, and I have rightly named it, gynecologists can make a difference. When it came to Millennium Development Goal, out of the 5 goals which were given to government, only 1 goal was met, and that was of maternal mortality. And this is all because of the hard work of gynecologists. And if cervical cancer prevention becomes the focus, the gynecologists will rise to the occasion, and they will make all the difference which the country needs. My flow of presentation will be focusing mainly on the WHO call, which has been given in November 2020. I will also touch on the COVID pandemic, talk on the HPV vaccination, and few of the questions which bothers gynecologists time and again while counseling the patients and their colleagues. The information and the statistics which are shared in my presentation, to my knowledge, they are latest, but at the same time, they will not supersede the guidance given by the Government of India or the medical profession. As far as the COVID-19 pandemic is concerned, we all know that it has badly affected the healthcare system in our country. Besides hitting badly the economy of the country, economy at the individual level, and you can see there is a lot of pressure on the healthcare workers, and they seem to be getting burnt out. But the silver lining is of this pandemic that the people have realized health is wealth. The only healthy people could survive and will survive in future. While we are waiting for COVID-19 vaccine, it has created a tremendous awareness on the significance of vaccine which have been there in the market, which are key factor for preventing deadly infections, diseases. As for the impact of COVID pandemic on immunization is concerned, we know that there has been a 50% drop in MMR rate, 42% drop in DPT rate, and 75% drop in HPV vaccination. The WHO has warned, because of the disruption of immunization services during this COVID times, vaccine-related diseases outbreaks can occur, and every government should be aware of the same. While we are waiting for a vaccine COVID-19, let us protect patients from the other vaccines preventable diseases. And today our focus will be human papilloma virus vaccine. At the outset, I wish to tell you, this vaccine is required for cervical cancer prevention. To eliminate cervical cancer, it cannot be an overnight job. It will take minimum 100 years. And that too also, if there's an effective strategy, is adopted by the government and the medical professionals. WHO has given a call, 90, 70, 90. This triple intervention, if done, by 2030, 30% drop will be there on the incidence and the mortality of the cervical cancer. This is the pyramid of cervical cancer prevention. As you can see, the base, vaccination forms the base. That's a primary prevention. Secondary prevention is screening and the treatment of precancerous lesions. Detected in time and treated, it can prevent cervical cancers 100%. There's no other cancer in man and a woman which can prevent cervical cancer to the tune of 100%. What we mean by 90% vaccination? We all know, as for the Western world is concerned, they've been working on cervical cancer eradication for the last 60 years. And in these 60 years, they've brought down the rate by 80%, and 70% reduction has been there in mortality related to cervical cancer. The poor resource countries, and we come in that particular category, we have to start taking the first step. So 90% vaccination, which WHO says, it means in the next 10 years, the focus should be on adolescent girls' vaccination. And vaccinating girls against cervical cancer before the age of 15 is the foundation for bringing down the incidence. Vaccination is not enough. The scaling up screening and the treatment for precancerous lesion at the same time will reduce the mortality to 1/3, which we are talking about. The evidence shows that if regular adult screening is not possible, which we talk about 21 to 65 years, at least screening done at twice in a woman's lifetime, that is at age 35 and 45, the cervical abnormalities are more likely to be detected in precancerous stage before they become cancer. And they can be treated, and then they can be elimination of cervical cancer. So when the future of cervical cancer elimination is talked about, WHO Global Strategy very clearly says, if the government and the medical profession rise to the occasion, then they will come on the right track by 2030. And total elimination will take place in 100 years, that is 2120. Remember, HPV vaccination coverage is the primary preventive intervention. This has to be added on that every woman, the poorest of the poor, has to have a 2 cervical screening in her lifetime. Then only elimination is possible in 10 to 30 years, depending upon which country we are talking about. If no action is taken, cervical cancer deaths will rise by 50% by 2030. This we are scared of. And that is why the approval of the draft of the global strategy of WHO has to be done by the government, and the investment by the respective government has to be there to deliver, because that is vital. Remember, elimination of cervical cancer is possible within the lifetime of today's youngest girl. But the time starts now, and every intervention counts. The contribution of every gynecologist, every doctor, every pediatrician, every nurse counts. WHO calls for that the respective governments join hands with medical fraternity, and now it is possible to eliminate cervical cancer. A couple of countries are already on the verge of getting declared cervical cancer free, because they've been working for the last 50, 60 years on this. But if they can do it, we can also do it. Let's come to the reality. Where are we? HPV vaccination status in India is less than 1%. If I am trying to be very honest, it is 0.01% of the eligible women are vaccinated with HPV vaccine in the country. And when it comes to cervical cancer screening coverage, it is merely 3% in the general female population. That shows long, long way to go. We all know that the cervical cancer, though it is number 2 cancer, but it is fatal because people present very late. this vaccine can be the game changer. This slide summarizes everything about cervical cancer as far as India is concerned. Annual deaths are over 60,000. Majority of the women who are lost are more than 40 years old, when the family needs them most. Their presence is that much required. The vaccination is less than 1%. The screening is only 3%. And we contribute to the 20% of the deaths because of the cervical cancer in the country, in the world. This slide shows that HPV vaccine has the highest impact among the available vaccines which are there. That had been stated earlier by Gabi, and now WHO in 2020 cancer report shows that if the 1,000 vaccinations are taken, 20 lives can be saved. And the next vaccine comes is hepatitis B, where the 1,000 vaccination can save 10 lives. This particular statement of mine should be noted by every gynecologist, how the lives is important, every life is important. Gynecologists play a very critical role in the woman care. They need to assess and vaccinate and do not lose any single opportunity to give vaccination to adolescent girls and for catch-up vaccination. WHO organization pleads in the next 10 years, adolescent girls require focus. For that, these people cannot be reached unless there is a government will to release the funds for the same. Giving vaccination is no difficulty. There are 4 reasons why should gynecologists prioritize HPV vaccination. You've seen the huge gap in the present state of vaccination and where we have to go, 90%. Foxy recommends $40 crores women and girls who are not vaccinated and need to be vaccinated. Adolescent girls require a focus in the next 10 years because we have almost 100% coming to the primary school where every girl can be vaccinated. Gynecologists should not lose any opportunity for catch-up vaccination because the woman comes to her from time to time for various problems of hers. And the gynecologists can see and treat, and they are specially trained to take care of these precancerous lesions. So the cancer service can be prevented altogether. Four reasons why they should not miss an opportunity for postpartum vaccination. Majority of we Indian doctors see the girls when they're married. And not only when they're married, when they're pregnant. Their first visit to the gynecologist is when they're pregnant. So while taking care of their pregnancy, while we are counseling for pregnancy vaccination, you must counsel at the same time that this particular vaccination, you'll be taking it soon after your birth. And what I found in my own practice is, it is very well acceptable. It benefits in the similar way as the adolescent vaccination. The completion of the schedule is complete and they have a high degree of satisfaction once they take this vaccination. So my plea to everybody who's listening me, your strong recommendations can make a difference to many girls and women by not letting them miss the opportunity to protect themselves from cervical cancer. Postpartum, just now I talked about. And now I'll take a couple of questions which are faced by the gynecologist. Now coming to the first question. How do I counsel patients for HPV vaccination, especially in the current COVID times? No doubt, the visits are limited. There's a compromised vaccination counseling time during her emergency visits to the clinic. In COVID times, teleconsultations have been approved by the Medical Council of India and the law, and we should adapt to the new normal of teleconsultation and tele-video consultations. Here I wish to tell you that counseling is an art. Everybody has to learn it, and we have to also learn the effective counseling technique. How should be the counseling like? It should be, I always tell, it should be like elevator speeches. Talk precise, talk quick, talk emotional. I've taken it, my daughter has taken it. Short, meaningful words. Don't mix signs. Talk quick, 15 seconds, 2 to 4 sentences. The example is right here. Today is the need of the hour. That HPV vaccination is given to your wife, to your daughter, to protect them from a deadly cancer, which is called cancer cervix, and let's join hands together for the good of this country. And do not talk in terms of percentage or immunity or sexually transmitted diseases. So the second question is often asked by most of the gynecologists and the doctors. When we have done screening for preventing cervical cancer, then why vaccination? Here I wish to tell you that this particular study has been done in India by ICMR. Well received by WHO, poor resource countries, and many other countries. What is the gist? The gist is if you just give the vaccination, only vaccination, and don't do anything, it brings down the load of the cervical cancer of this country by 45%. And if you combine 2 to 3 cervical screening for an individual woman, it can bring down the rate by almost 60% plus in this country. And this is what WHO is talking about. CDC advises not only to rely on cervical cancer screening. You've seen the Western world. They brought down the incidence by 80%. They brought down the deaths due to cervical cancer by 70%. But to reach to 100%, once they have adopted vaccinations, few countries are already on the verge of getting declared cervical cancer free. No doubt the cervical cancer screening is very easy, but other HPV-related cancers, the screening can be difficult, but if you give a vaccination, minimum 90% HPV-related cancers can be prevented. Postpartum vaccination, isn't it too late? Sometimes the question is often asked, which to my mind is a theoretical question. I have not found any question, any patient talking to me that, why are you doing it is late? This slide shows that the HPV does not discriminate by age. Woman remains at risk of acquiring HPV infection throughout her lifetime. And I'm blunt to say that every time she's exposed to sex, she gets a new virus. The studies have shown, and there's a strong data, that the risk of progression from CIN1 to CIN3 in cancer increases with age. The risk is 7 times higher for women who are more than 30 years in comparison to the women who are less than 30 years when exposed. Again, there's a big myth in people's mind, especially doctors, gynecologists' mind. They feel that vaccination can't be taken and not effective after, once they become sexually active. Now, good studies are there in public domain, which shows that the efficacy and the effectiveness of the vaccine remains, especially the quadrivalent vaccine, where the studies have been done, is almost the same for all those precancerous lesions. Do I need to vaccinate my patients if she is already positive for any HPV serotype which is there in the vaccination? Fortunately, this study is often quoted that very, very rarely you find that a woman is positive for all 4 types of HPV virus which are there in the vaccination. Only 0.1%. By this I mean 99.9% women who are sexually active, the vaccination will be effective. So I repeat again, the majority of the sexually active women can get benefit from quadrivalent vaccination, because this particular study has been done with a quadrivalent vaccination. Doctors, patients, parents are always worried about one thing: safety of the vaccine. Robust data is there. In the phase 3 trial, 30,000 subjects were enrolled, and post-license studies are there. 1 million subjects had been closely followed up for its safety and efficacy. More than 300 million doses have been dispensed worldwide, and this is the data, the cutoff is 2018, reaffirmed that it is safe. 9 big bodies of the world endorse about its safety. CDC website will show you there are questions related to HPV vaccine safety, and all have been answered very beautifully, and finally it is cleared. The same WHO clearance has been there about the safety of this vaccine. Many times I find that in a social media group, sometimes the questions are often raised. People, like, always tell them that you should become knowledgeable yourself by reading it. And reading it, you go to these websites and you'll find the answers. WHO position paper of 2017 clearly states about its safety. The termination of pregnancy is not indicated if vaccination was inadvertently taken during early pregnancy. This vaccination is otherwise not to be given during pregnancy. Breastfeeding is not contraindicated for HPV vaccination. As far as the vaccine and infertility is concerned, people raised questions that after taking this particular vaccine, the woman can become infertile. Again, this particular thing has been taken up by WHO and other bodies, and very clearly they have concluded that the safety of HPV vaccine is well received, and it is not, HPV vaccination does not cause any infertility. The same, it has got a clearance that HPV vaccination does not cause infertility. Is HPV vaccination safe in lactating mother? I just now said it is as safe as in other states. The American College, the CDC, and the World Health Organization endorse the safety of this particular vaccine during lactation time. Patients are concerned that the disease happens, you give the vaccination early, you don't give any booster. Will this be effective in the later stages of life when the cancer occurs? Again, the robust data is there. 0 breakthrough. Long follow-up showing its well-proven effectiveness and long-term protection. How do I complete HPV vaccination when the schedule has been disrupted because of the COVID lockdown? We should remind everybody here that the WHO clearly says between 19 to 14 years, there are 2 vaccinations. Only past 14 years, the 3 vaccinations will be required. Normally, the schedule is of 2 doses is 0 and 6 months plus. But in case if it has been disrupted, the doses can be taken within 1 year. Again, for 3 doses, the formula remains the same. Again, there's no maximum interval has been worked out that after 1 year, if the gap has been there, you cannot be taken. There's no need of repeating HPV vaccination because I think the data is coming up like this, that once the WHO puts it up, we will follow it up. But what is the news is that even 1 vaccination is going to be effective. That's why, so let the gap be there and let the schedule be completed. Now, coming lastly to 4 reasons why you should choose quadrivalent vaccine. I always say this vaccine has been tried in lactating mothers and it has been safe. The other vaccine has not been tried in lactating mothers. So you should use this vaccination. Again, we have data, the data provided by quadrivalent vaccine shows that it is equally effective in a sexually active woman. Study I just now quoted. It has got proven effectiveness and proven safety profile. But while taking care of the pregnant patients and the lactating women and vaccinating them in the lactation time, this adolescent girl is the focus in the next 10 years. And our aim is 90% girls before they reach the age 15 should be vaccinated. I never said that you do not do catch-up vaccination. You do. But this girl requires a focus, especially from the government of India. We can't vaccinate them unless we get the funding from the government. So there are 4 reasons why adolescent girl requires a focus. Firstly, economical. She requires only 2 doses. We save the money. Secondly, they higher antibody response. And thirdly, we know that if she gets exposed to sex, her chances of getting HPV infection is much, much more because of not proper maturity of the epithelium. And it's always good to immunize before they're exposed to sex. And coming to my last and concluding slide, with my folded hands, I say, the effective HPV vaccination and screening by doctors, nurses, counseling and strong recommendation, all it takes to protect a woman from cervical cancer. Thank you very much.
Thank you so much, madam, for your eloquent speech. And we are moving towards our second session.